Good afternoon. Thank you for joining our Facebook Live presentation on COVID-19 vaccines and Group 6 and 7 eligibility. I'm Jonathan Modi with Oregon Health Authority Communications. We are joined by Dr. Dana Hargunani, Chief Medical Officer for Oregon Health Authority, who will talk about vaccine safety and effectiveness, and Rachael Banks, Director of the Oregon Public Health Division, who will discuss the groups that have become and will become eligible to receive the vaccines. After their brief presentations, we will open it up to questions. To ask a question, you'll submit your question in writing in the chat section. And with that, I'll ask Dr. Hargunani to kick us off.
Thank you, Jonathan. I want to start with a quick update on the state's COVID-19 outlook. Although more Oregonians are getting vaccinated each day, and we all continue our individual efforts to control spread of the virus, we have seen higher daily COVID-19 case counts over the past week, according to OHA's COVID-19 weekly report released yesterday. OHA reported 2,456 new daily cases of COVID-19 during the week of Monday, March 22nd through Sunday, March 28th. This represents a 28% increase from the previous week. However, new COVID-19 related hospitalizations fell slightly from last week, and deaths also decreased, with Oregon seeing its lowest weekly death total since June. We remain concerned about new COVID variants. So while access to vaccine continues expanding throughout our state, we need to keep practicing preventive measures to slow the spread of disease, such as maintaining a physical distance, wearing a mask, avoiding gatherings with non-household members, and practicing good hand hygiene. Now I'd like to talk about the COVID-19 vaccines now being provided in Oregon, the safety and effectiveness of those vaccines, and how they can help us reduce transmission of the virus and eventually bring an end to this pandemic. There are 3 safe and effective COVID-19 vaccines available today. The Pfizer-BioNTech vaccine is a shot that is given in 2 doses separated by 21 days. It has received emergency use authorization and is recommended for people 16 and older. Based on evidence from clinical trials involving more than 43,000 participants, the vaccine was found to be 95% effective at preventing laboratory-confirmed COVID-19 illness in people without evidence of previous infection. The Moderna vaccine also is a shot given in 2 doses, separated by 28 days. It has received emergency use authorization and is recommended for people 18 and older. Clinical trials involving about 30,000 participants showed the Moderna vaccine was 94.1% effective at preventing laboratory-confirmed COVID-19 illness. The Johnson & Johnson vaccine is a one-shot vaccine that has received emergency use authorization and is recommended for people 18 and older. Clinical trials involving about 40,000 participants found that the Johnson & Johnson vaccine was 66.3% effective at preventing laboratory-confirmed COVID-19 illness. All 3 vaccines were tested among people of diverse age, sex, race, and ethnicities, and among persons with underlying medical conditions. And all 3 were found to be highly effective at preventing hospitalization and death in people who did get sick. While many people have no side effects from these vaccines, the most common reported side effects are generally mild and include pain, redness, and swelling in the arm, tiredness, headache, muscle pain, chills, fever, or nausea. These side effects were normal signs that your body is building protection and should go away within a few days. None of these vaccines will change your DNA or give you COVID-19. Many people ask which vaccine they should get. The most important thing to remember is that all 3 COVID-19 vaccines are safe and effective, and that the Centers for Disease Control and Prevention and OHA do not recommend one vaccine over another. Do not wait for a specific brand. Getting vaccinated as soon as you are able with whichever vaccine is available will help us build community immunity, bring this pandemic to an end, fully reopen the state, and let us return to the activities we enjoy. I'll now turn it over to Director Banks.
Thank you, Dr. Hargunani, and welcome everyone. It's great to be here with you all today. So I'd like to talk with you about who is currently eligible to receive the COVID-19 vaccine, who will become eligible in the weeks ahead, and how you can register easily today for getting vaccinated, or once you become eligible through the Get Vaccinated Oregon tool. So last week, Governor Kate Brown announced that 22 counties had begun their Group 6, 1B Group 6. These counties, which have started, have stated that they largely have completed vaccinations of Oregon seniors and other previously eligible groups. And on Monday of this week, eligibility expanded beyond those 22 counties to include all Oregonians in Group 6. This group includes individuals in health, home, or work situations that have put them at a higher risk for infection, such as adults 45 to 64 with underlying health conditions, migrant and seasonal farm workers, seafood and agricultural workers, food processing workers, people who live in low-income senior housing, or perhaps senior congregate housing or independent living situations, people experiencing homelessness, people currently displaced by wildfires, wildland firefighters, and pregnant people over 16. Beginning Monday, April 5th, all Oregonians in Phase 1B, Group 7, get added to the COVID-19 vaccine eligibility pool. That's 2 weeks earlier than previously planned, which is great news. This group also includes many individuals in high-risk health, home, or work situations. For example, it includes frontline essential workers, such as grocery workers, postal workers, those who work in transit, restaurants, utilities, all types of construction, and including affordable housing employees, and people who have regular, routine, close contact with others outside of their households and who cannot do those jobs from home. It includes individuals living in multi-generational households, which includes those living in a home where 3 or more generations reside, or individuals who are living and caring for a relative who's not their own child, such as a grandchild and a niece or a nephew, and adults 16 to 44 with underlying health conditions. With the vaccination of Group 6, populations starting early in 22 counties, and with moving eligibility for Group 7 up by 2 weeks, we can reach many communities that have been hardest hit during the pandemic, including Oregon's Black, Indigenous, Latino, Latina, Latinx communities, Asian, Pacific Islander, tribal communities, and other communities of color, and get them more time to get vaccinated. That's another critical step forward in our effort to eliminate health inequities in the state by 2030. And as more vaccine doses become available and more people get vaccinated, we continue to stick to our plan of opening up vaccination to all Oregonians no later than May 1st, but in some counties, it could be sooner. I know this is welcome news for many of you. Finally, we are encouraging everyone to get registered for vaccination through the Get Vaccinated Oregon eligibility and notification web tool at getvaccinated.oregon.gov. By the end of last week, more than 500,000 people had registered at Get Vaccinated Oregon, with the tool now supporting 10 languages in addition to English. After you answer a series of questions, the Get Vaccinated Oregon tool, or GVO tool as we like to call it, tells you if you meet the current statewide vaccine eligibility criteria, and it enables you to set up text or email notifications to learn when you become eligible at the state level. Once you're eligible, this tool will also help you find a vaccine provider or a vaccination event near you. Individuals who need help registering for or using the Get Vaccinated Oregon tool can reach out to 211-INFO by dialing 211 or 866-698-6155, and that's toll free. You will not be asked for your Social Security number or financial information to schedule a vaccination, and this information should not be provided. Health insurance information may be requested, but it's not required. Vaccinations are free for everyone. Now I'll turn it back over to Jonathan.
Thank you, Rachel, and thank you, Dr. Hargunani. We'll now open it up to questions. Just a reminder, this is a Q&A on COVID-19 vaccines and group 6 and 7 eligibility, so we won't be taking questions on other topics. Again, to ask a question, please submit it in writing to the chat section. The first question is from Brandy. I hear this injection is not approved by the FDA and is experimental.
Yeah, so the U.S. Food and Drug Administration, the FDA, is the agency responsible for regulating vaccines, including the COVID-19 vaccine, and they have authorized all 3 of the vaccines for emergency use. This is allowable and is used in emergency situations or quick situations as we are in COVID, and it allows the vaccines to be distributed in the United States. The FDA, the Food and Drug Administration, has employees who do a review, and these are career scientists, doctors, experts in the field that do a thorough review. It's the most thorough review that's seen in the world, actually. And they've carefully reviewed the data on COVID-19 vaccine safety, effectiveness, and also manufacturing quality, and have issued the emergency use authorization. They know that the authorization means that the benefits outweigh any risks, and these vaccines are continuing to be studied after the EUA was approved.
Thank you, Rachel. Next question is from Wendy. I'm still confused about how this vaccine protects loved ones. It supposedly just lessens your symptoms should you get it, but you're still contagious. What am I missing?
Great question. Thanks, Wendy. So yes, I mean, as I mentioned in the past question, we are still learning about this vaccine and gathering data and evidence. But what we know that the evidence from the vaccine trials and subsequent research is encouraging about transmission. But for sure, the vaccines are extremely effective in preventing serious illness and death from COVID-19. Because we're still finding out information about the transmission and how it could be spread with vaccinations, fully vaccinated people should continue to wear masks and stay 6 feet apart from other people in other settings, like when they're in public or visiting with unvaccinated people from multiple households.
Thank you, Rachel. Question from Lynn. In what world should we assume the vaccine is safe for pregnant women with 0 data? At least 69 miscarriages have been reported to VAERS.
Thank you, Lynn. This is a really important question. Currently, there is no evidence that COVID-19 vaccination causes problems with pregnancy. Like all vaccines, and Director Banks has mentioned, scientists are continuing to study COVID-19 vaccines carefully for safety and side effects now and into the future. According to VAERS, or the Vaccine Adverse Events Reporting System data, at this point, miscarriages do not appear to be happening more frequently in vaccinated women compared to women who are not vaccinated. It's important to consider consultation with a medical provider to help inform decisions, and pregnant women may choose to do so when considering vaccinations. Some things to be considered for someone making this decision, to consider the level of COVID-19 in the community and the risk of transmission. Of course, we're seeing increased COVID-19 cases both in the state and nationally, so that's an important point to consider. Also, consideration of the personal risk of acquiring COVID-19, such as occupation or other activities. A woman might want to consider the risk of COVID-19 to her and her fetus, and we have growing data to show that there is increased risk of COVID-19 for pregnant women. Of course, considerations for the efficacy of the vaccine, potential side effects, and data about vaccine safety during pregnancy. And finally, just want to say that we do not recommend routine testing for pregnancy before vaccination.
Thank you, Dr. Hargunani. This is a question from Laura. Why isn't there a separate eligibility group for people 45 to 64 who don't have underlying conditions? Why is this group lumped in with everyone else that becomes eligible May 1st?
Jonathan, will you just repeat the question? Thank you.
You bet. Sorry about that. This is from Laura, and she asked, why isn't there a separate eligibility group for people 45 to 64 who don't have underlying conditions? Why is this group lumped in with everyone else that becomes eligible May 1st?
I can start to answer that question, and then if Dr. Hargunani wants to chime in. In general, there's a variety of factors that went into eligibility criteria. And one of them was working with the Vaccine Advisory Committee, who's really looking at health inequities and risks. And the reason why 45 to 64-year-olds or any age with underlying health conditions were pulled out separately is because of their increased risk for, because of underlying health conditions, to getting severe COVID-19 or having hospitalizations or deaths if they were to contract COVID-19. So that's one of the reasons why we pulled out the underlying health conditions specifically in those age groups.
Thank you, Rachel. Next question is from Marjorie. What is the status of securing enough vaccines to give to all Oregon residents?
I can take that question first. Thank you for the question, Marjorie. At this point, we are on track for being able to open up eligibility to all Oregonians who are eligible for vaccine according to emergency use authorization starting May 1st. We have continued to receive an increase in supply of vaccine from the federal government. We continue to monitor this closely, but at this point, we stay on track for eligibility for all Oregonians starting May 1st.
Thanks, Dr. Hargunani. Rosalie asks, my second shot is scheduled 28 days after my first. I thought you were supposed to get the second Pfizer dose 21 days after the first. Is this okay? Is it okay to get your first and second shots at different locations?
I can also start with that answer. It is okay to wait a little bit longer than the normal interval between vaccines. We want people to get their vaccines within 6 weeks of each other. What I shared earlier in my talking points about the intervals for vaccine are what were approved under the emergency use authorization. So most people will get them right around that interval, but within 6 weeks is what is recommended. And so your second shot sounds like it is scheduled perfectly appropriate. We do recommend people try to get their first and second shots at the same location. This is because we want to make sure that we're sending those second doses to the right location. And so everybody has the opportunity to get that second dose as we manage how we allocate these vaccines. But if it's not possible to get your second dose at the same location, you can go to a different location if that's necessary for your situation.
Thanks, Dr. Hargunani. This is a question from Drew. Group 7 eligibility states type 2 diabetes as a co-occurring condition. Does type 1 diabetes also qualify for the 4-5 eligibility group, as both are identified by the CDC as being at risk due to COVID-19?
So thank you for that question. Recently, we've known that the CDC, the Centers for Disease Control, has made some modifications to their risk categories. We're currently taking those under advisement and anticipate updating our eligibility that there may be more information coming out as early as tomorrow.
Thank you, Rachel. Jason asks, when will UPS employees be eligible?
So UPS employees are in that, when I talked about the talking points, transit workers, in that frontline workers category in group 7. And so they will be eligible along with that group. And their information in the chat that has an infographic where you can look and see when eligibility happens. So the dates that you'll see on there are no later than dates, and in some counties, those groups may be eligible sooner than that, depending on where, which county folks live in.
Thanks, Rachel. Linda is wondering, she'd heard that Johnson & Johnson had to toss 15 million doses. Next week, she hears that we were supposed to receive a big batch of Johnson & Johnson. Will people in Southern Oregon see some of that?
Thank you for the question. Yes, we in Oregon are monitoring the situation closely from the news about the Johnson & Johnson vaccine yesterday. At this time, we understand that vaccine planned to be delivered next week is still intended to be slated as expected. And that includes vaccine doses of Johnson & Johnson that will be distributed across counties across the state. So yes, Southern Oregon is expected to see Johnson & Johnson vaccine next week. We do not have the full understanding of the implications of the Johnson & Johnson vaccine news in terms of supply throughout April, and we'll be continuing to keep a close eye on that.
Thanks, Dr. Hargunani. Pardon me. This is a question from Anda. Can we have a choice of vaccines at the vaccination sites?
Well, some vaccination sites, thank you for that question, and some vaccination sites may be getting more than one vaccine, but many of them will be just getting one vaccine. So we have asked for vaccination sites to make it known which vaccines that they're getting. At the same time, as Dr. Hargunani talked about in her talking points, all 3 vaccines are safe and effective, and we're really encouraging folks to get the first vaccine that they can get. When people ask me, what's the best vaccine I should get? It's like the first one you can get, so that we can get through populations and that we don't have vaccine appointments sitting there that somebody else could use.
Thanks, Rachel. It's a question from Erica. Does asthma count as a qualifying underlying condition?
Thanks for the question, Erica. At this time, no. We've mentioned already that Oregon's been looking at the evidence supplied by the CDC related to which underlying health conditions confer the highest risk of severe disease, such as hospitalization or death due to COVID-19. Just this week, the CDC has updated the evidence relating to underlying health conditions, and we're looking closely at that data right now. We expect there can be updates to qualifying underlying conditions for vaccine eligibility to be announced as soon as tomorrow. So please stay focused on new information as we take a close look at the CDC information just provided this week.
Thanks, Dr. Hargunani. This is a question from Debbie. Do I need to bring proof of my underlying conditions?
Thanks, Debbie. No, we're not asking, Oregon Health Authority is not asking that people bring proof or medical records or anything like that, or for that matter, Social Security numbers. And that said, you may be asked to attest at different vaccine sites or in the tool to say that you have one or more of those underlying health conditions, not to disclose which one, but just simply to attest that you're eligible for vaccination by way of underlying health conditions or another eligibility criteria.
Thank you, Rachel. Michelle asked, do I need to live in the county I get vaccinated in?
Thanks for the question, Michelle. The answer is no. You can get vaccinated in any county in Oregon. However, while vaccine allocations to Oregon continue to increase, vaccines may remain in limited supply. So if you are eligible to receive a vaccination, we do encourage you to try to get vaccinated in the county you live in. We're using population data to decide kind of what number of allocations are going to each county. So for now, it would be helpful to get vaccinated in your own county that you live in, but you don't need to.
Thanks, Dr. Hargunani. This is a question from Linda. Why aren't more appointments available?
I know, right, Linda? I know it's frustrating that there's not more appointments available, and that ultimately that we don't have more vaccines quicker. We know that appointments, generally speaking, open up for the mass vaccination sites on Sundays. So that would be a good time to check. And as we get more and more vaccines, we're going to be opening up as many appointments in a variety of different places so that folks have a lot of options of places to get appointments for vaccination. But I do understand it can be frustrating while we're in this point of not having enough vaccine.
Thank you, Rachel. Martina asks, can somebody please talk about the process of getting a vaccination appointment? Do I register with my health insurance, Oregon Health Authority, hang out at drugstores?
Yeah, thank you for that, Martina. Question. There are a number of ways. One path is through, if you have a health provider who has vaccination and who has vaccines, to register through that. The other is the Get Vaccinated Oregon tool that I talked about a bit earlier, where you can enter your information and receive a reach back out from us via text or other means when vaccinations near you open up, vaccine events open up. You can also call 211-INFO to have assistance in registering for vaccine appointments.
Thanks, Rachel.
And I believe there may be more information about the Get Vaccinated Oregon tool in the chat.
That's right. Thank you so much. This is the last question from Jennifer. Why are we not vaccinating children?
Jennifer, thanks for your question. As a pediatrician and mom, this is really important to me as well. So the current emergency use authorizations from the FDA do not allow to vaccinate children under the age of 16. At this point, only the Pfizer vaccine has been authorized for vaccination down to age 16, and the Moderna and Johnson & Johnson vaccines have been authorized down to 18 years old. COVID-19 vaccines are currently being tested in children. You might have seen news just earlier this week about the Pfizer vaccine. The company has started to share data and have suggested that the data is looking good for kids down to 12. We expect the FDA to be receiving an application for emergency use authorization of the Pfizer vaccine down to age 12 in the coming weeks or few months. But until then, we have to wait until that happens, and we can only use vaccine for children down to 16 at this time.
Thank you, Dr. Hargunani. Thank you, Rachel. And thank you, everyone, for joining our Facebook Live discussion today. Please check out the link in the chat, the links in the chat, and have a great rest of your day.